My name is Matt Gammons. I'm a sports medicine physician at the Vermont Orthopaedic Clinic. I also work at the Killington Medical Clinic up on the mountain in the winter. I help cover Castleton State College, Green Mountain College, a bunch of the local high schools, U.S. ski team, and so we sort of have pretty wide sports medicine coverage in this area. The purpose of this talk, and my wife can attest to how mad I get in the evening time when I watch the news or watch ESPN at the amount of sort of bad information I think gets put out there about head injuries and concussions. I think it's a wonderful thing that we've have increased awareness of concussions and head injuries and what it means to athletes and what the potential downsides can be. But the problem with the media as usual is everybody's sort of fighting for that story to get it out fast, and they 99.9% of the time they have the facts wrong. Not necessarily intentionally, and this is not, and having dealt with the media on many different levels, sometimes the teams actually release bad information, which then leads to bad reporting. So just a few goals. Basically, I want to define the scope of the problem, try to give you an idea of what we think concussions are, how things have changed, how we can, most importantly, get athletes back to play safely. And then talk about, you know, the sort of the thing that most people are concerned about nowadays, and particularly when you see the news, is what's the long-term consequences? How can we sort of try to protect our athletes for those long-term consequences? What do they mean? And at the end, we'll talk a little bit about prevention. I'm going to start off with a case study. So this was a male athlete who's had 7 concussions. And you can see them listed there. So starting at age 12, going all the way up to about age 25. A few of them had loss of consciousness and amnesia, a few of them didn't. So that's a pretty wide range basically going on for about a 12 or 13 year period. If you just looked at this, and if somebody came to my office with this concussion history, I would look at it and say, geez, that's pretty significant. I mean, 7 concussions in that time frame, you know, that's something that we ought to take a look at. Well, you know, the answer, I mean, there's no really easy answers, but in the end, you know, when you look at that, you say, well, what do we tell this athlete? Somebody's had 7 concussions. Is there anything else that's important, anything else we should look at? In reality, well, there is a lot of other things that are important in terms of just not the number of concussions, and we'll get into this later, but in this particular athlete, there really didn't seem to be any changes in terms of behavior, in terms of grades, in terms of no problem concentrating. And actually, if we go back up one quickly, you can see in most of the cases, the symptoms pretty much resolved relatively quickly in almost all these concussions. So if we go down, again, this particular athlete continued to play sports, multiple sports, including college soccer, a little semi-professional soccer, managed to graduate college, managed to get through medical school, and managed to get through residency and fellowship just fine. So, and an ugly-looking guy up there. So that was obviously me. I have had 7 concussions. I might have had a couple more. It's hard to know in all those years that I played. But the point I want to bring up is, number one, I have personal experience with this. I've had concussions. I've dealt with both sides. I probably see, you know, as many concussions as anyone as an individual physician in the country, just by nature of where we are, because of the ski mountain, because of the amount of schools that we cover. My personal feeling is that really it is very difficult to say that you're an expert at head injuries and concussions. The reason being, I don't think we have enough information for anybody to really be an expert. You have lots of people with experience who know how to sort of deal with these injuries and see a lot of them. I'm going to kind of interject a little personal bias here, because I think it's really important. When you have information, whether it comes from me or from someone else or from the TV, there's always bias. We all have our own biases. I think where we are today with concussions is better than where we were 20 years ago, 15 years ago. But I also think that we're too far to one side of the pendulum. And we used to sort of talk about, oh, don't worry about it, you just got your bell rung. And now we've kind of swung past the middle, and now we're way over here where every single time you bump your head, you're going to have chronic problems from it. You know, you're going to be demented and you're going to have issues. And really, my personal feeling is somewhere in the middle is the nice balance there. Because most people, or I shouldn't say most people, most athletes that sustain a concussion, and we'll go over this, are not going to have a problem with residual symptoms going on and on. So most everybody's going to do fine. We want to certainly try to weed out the ones that aren't going to do fine. But in the end, we don't have to sort of, it's really great that we educate, it's really great that we're aware, but we don't have to hit the panic button every single time we see an athlete who hits their head. So what is a concussion? Well, this is part of the problem. We really don't know exactly what a concussion is. We have 2 different groups there that have tried to define concussion. They're both relatively similar. In simplest terms, you get hit in the head and you have symptoms that sort of relate to brain function, meaning I have amnesia, or I can't remember well, or I have difficulty concentrating, or I have headaches. But in reality, we're still trying to define exactly what it is, and that's really what makes it hard to sort of define the total scope of the, what's going on. So there's this sort of debate over whether or not a concussion is the same thing as a traumatic brain injury. Well, the answer is maybe, but we're not sure. So we traditionally sort of discussed concussions as what we would consider a mild traumatic brain injury. But there's been a push to sort of separate concussions from that, and there's some good and some bad about that. The good about that is it sort of takes that panic mode out of sort of, oh my gosh, my child or my son or my daughter has a traumatic brain injury. The bad about it is it may minimize things a little bit, and people say, oh, don't worry about it, it's just a concussion. But the reason that the push has been there is for the reason that we talked about, is that concussions 99.99% of the time resolve without consequence and don't go on to cause further problems. So the reason people are kind of pushing that is mostly from a research definition is we really want to try to research concussions as a subset, not in the bigger sort of picture of traumatic brain injury. And traumatic brain injury is a completely different animal than concussions in terms of the injury, what happens, the residual symptoms. Now, there's certainly some overlap and there's some similarities. What we think we know about concussions is that it's not a structural injury, at least on the macroscopic level, on the big level, that it really is a functional injury. It's a problem with how the brain is functioning. You can think of the brain as the electrical system. There's a problem with the electrical circuits. The circuits are still intact, but things aren't flowing normally. It's one of the reasons, we'll talk about it later, but again, by definition, CAT scans and MRIs and things are normal in a concussion. If they're abnormal, it's not really technically a concussion. So there's some differentiation there. There's some newer techniques, and we'll talk about them later, where we may see some changes. But in reality, we've gone away from imaging almost all concussions because we know that it doesn't really give us any information unless we think something else is going on. And what we realize is that we think it's a metabolic injury. With the tests that we can do, you can see that the brain cells, which use exclusively sugar as their fuel, stop taking up sugar normally. And then they actually start to over-uptake it depending on where you are in sort of the recovery process. So there's something that's going on with how the cells are getting their energy that gets disrupted by this injury. So where does one cross the line, like we talked about, from concussion to sort of the traumatic brain injury? Well, you can't really draw the line. Like I said, we've tried to push concussion way over onto that mild side, but in reality, it's a moving target. I mean, things ebb and they flow, and every individual is different, and multiple concussions might push you a little bit more towards the right-hand side of that graph, whereas, a single concussion might keep you over there. So there's really not a fine line there in terms of what we talk about. So when you hear people talk about concussion, mild traumatic brain injury, sometimes they're talking about the same things. Most of the time, people will refer to concussion as a mild traumatic brain injury if they're not saying concussion, whereas again the traumatic brain injury is something different. So what's the scope? Well, we're not entirely sure for the reasons we stated, reporting definitions and things, but basically we think somewhere just under 500,000, but some estimates have estimated upwards of 10 times that amount, so 4 million a year, based on things that they've found, and that's just in the United States, that's not worldwide. So worldwide, obviously the problem is much higher. And we don't know exactly, again, because most of the concussions that occur in this country we don't see. We don't see them, or they just see the athletic trainer and myself on the sideline, and they never go through the emergency room or through the office. And so if someone's doing a database search of what went through the hospital, that's all they get. They just get this little subset of what went to the hospital. And so obviously there's a lot of biases that go into that particular data, and we'll talk about that with some of the stuff that's been out in the media recently, how we have to cautiously interpret that. So concussion rates. This is an example of concussion rates in high school sports. I apologize for the technicalities, but basically they're ranked from highest to lowest, and the injury rates are per 1,000 athletes exposures. 1,000 athlete exposure just really is a way for us to sort of take a group of athletes and try to standardize them in terms of how often they're exposing themselves. Because remember, if I'm playing football but I'm on the sideline, I'm really not at risk to have a concussion. If I'm playing football and I'm in the game, that's a lot different. So that's just kind of in the medical literature when we study things, that's kind of one of the ways that we try to standardize it. But you can see concussions, are generally highest in football. Participation is generally highest in football. It's a collision sport and going down. And this doesn't obviously include things like skiing and snowboarding. Doesn't include things which make up about 3 to 5% of injuries in skiing and snowboarding, depending on the study you look at. But it gives you a relative idea of risk in terms of where we're generally seeing these head injuries. So one of the things we want to know, and this is actually, and we'll talk about a study that actually came out in a minute, but are head injuries increasing? Are we seeing kids with more concussions? And the answer is absolutely. We're seeing more kids with concussions, but it may not be that there's more concussions happening. Meaning a lot of this is an awareness factor, meaning that we've done such a good job and the media's done such a good job of putting out the word that we're now seeing the concussions that that were happening, but we just weren't coming to us. So you have to be careful in this data. Again, when you look at the high school football, concussions overall seem to be increasing, but as a matter of fact, in the last 10 years, they're actually down. So they kind of went up from 89, they sort of peaked at 99, and in 2009, they've kind of come back down. Now, they haven't come back down to 1989 levels. But again, these numbers aren't corrected per se for that exposure. They're not corrected for, again, the media. It'd be interesting to do, and no one's really done the study, is to go back in each of those years and find out how many headlines were in the news on concussion, because there's been a lot more in the last 5 to 10 years than there was in the previous 5 to 10 years in terms of concussion. So again, what we're doing is we're not necessarily decreasing or increasing the rates of concussion, we're just increasing the rates of the concussions that we see, which I think is a good thing, meaning we're seeing and we're evaluating them more. Some recent NFL data that's not yet published but going to be published here relatively shortly basically showed that concussion rates in the NFL were essentially stable from that 6-year period of 96 to 2001. From 2002 to 2007. And there was a little drop, which those numbers, again, can be a little confusing. They are actually what we call statistically significant, meaning they did actually show a trend for decrease. We're not sure why that is. We think it's because the NFL's become a little more conservative with the return to play. So we're not seeing as many of those repeated concussions right away that you see sometimes, but we're not sure. Really confusing slide. Just pay attention to the dashed line that's going up and the little dotted line that's kind of going up. Those two lines basically represent concussion rates that were seen in emergency rooms from the years 1997 to 2007. You can see they both go up. The black line that's coming down actually represents participation, meaning how many kids were participating. So you kind of have this data that says less kids are participating, but we're getting more concussions. This was just, again, this was all over the news a few weeks ago. It was a really well done study, but all it was basically, it was an ER data study. They took a bunch of ERs and they just went through their subset of diagnose. They just went through the charts and said anybody who had a diagnosis of concussion, and they pulled that out. They didn't do any sort of comparative data to check other hospitals, to check other places. They didn't sort of check to see how standardized was the evaluation as to what they were calling concussion and what wasn't being called a concussion. So the answer is that the data is probably true in the sense that the ER rates, the ER sort of visit for concussions went up. But again, it's probably not as dramatic in terms of increasing numbers of concussions as it is the ER just happened to see more concussions, and the ER docs and the ER staff were diagnosing concussions better. Meaning instead of just saying, I think you just rung your bell and sending you out and not putting concussion down as a diagnosis, that bell ring now became actually a concussion. So you sort of have a reporting thing as well. I know it's a little confusing, but it's kind of one of those pieces of information that the media takes and says, oh my God, there's this rash, there's 10, 15, there's 30 times, all our kids are going to have problems, and they throw it out there in this really dramatic way, and when you actually look at the numbers, it's not as dramatic as it might seem. So we're going to talk briefly on the biomechanics of head injury. How do we get concussion? How do we get head injury? Well, again, remember the brain is mostly water. The brain kind of sits in this fluid. It does have not a lot of mobility, but has the ability to kind of slosh around with inside the skull. Some people's brains more than others slosh around depending on how much room you have. So again, when we talk about collision forces, that's what we're really talking about. So when you're talking about both concussions and skull fractures and severe traumatic brain injuries, what you're really talking about is how much force is being applied to the skull or to the face or to somewhere else. And you can see basically that, you don't have to be going very fast, 10 to 20 miles an hour. And we talk a lot about this with skiing and snowboarding, which isn't very fast on skis or on a snowboard. And you can generate significant force to the head, and it goes up exponentially. So, the force at 20 miles an hour is not double 10, it's probably quadruple 10. So it's an exponential curve as it goes up. Remember, force equals mass times acceleration, in kind of the old physics class here. The importance of this is, remember, helmets have mass. Just remember that. We're going to talk a little bit later about helmets and concussions and things. But just remember that particularly like things like football helmets have some substantial mass to them. Here's how we think head injuries happen. There's several mechanisms. One is the direct impact. So just like a driver hitting a golf ball off a tee, I'm standing there and someone comes up and hits me with a baseball bat. There's direct force applied to the skull. I can get direct injury underneath. I can get skull fractures. I can get bleeding. And most of that injury is right where I got hit. I'm not moving anywhere. I'm standing still. This is the least common cause of concussions in sports. Why? Because almost always we're moving. right? Almost always in sport, you're moving around. You're not sort of standing in one place. It happens, but it's the least common sort of way that we see them. When we talk about sort of the contra-true injuries, or when the acceleration-deceleration force, you can see this guy when it loops through again, as he hits the snow, his head kind of snaps real quick. So there's that force that gets generated. The brain is moving, it's moving, it's moving, boom, and all of a sudden the brain stops because the head stops. It hits the ground for a second. So those are the forces. This is, we think, the most common cause of concussions. The brain, I'm moving, I'm running at somebody, I'm running to tackle somebody, I'm moving at a speed, and then all of a sudden I come to a stop because I hit an object, another player, or I have hit a tree in skiing or snowboarding. It's those acceleration, deceleration forces that we think are most important in terms of what causes these head injuries. And then, of course, you have the tumbling falls. These are we talk about. You don't have to hit your head to necessarily get a concussion. Talk about that rotational tumbling fall. I think this guy did hit his head, believe it or not, but it's a pretty dramatic video, so it's kind of fun. But basically, we see these kind of tumbling falls, and you see them sometimes in ski racing in particular, you know, that kind of cartwheel sort of fall where they never really looks like they actually hit their head, but there's enough force generated by that rotation to cause an injury. So we'll keep in mind, again, the acceleration-deceleration force. That's going to come back. Those are the forces that we think causes the sort of the brain injury. Not the bleeding, not the skull fractures, but the concussion-type injuries that we're seeing. And the other thing we have to remember is that it's cumulative, meaning both straight inline forces and rotational forces may add up together. So if I'm going one direction and then I get snapped in another direction, those forces may be additive. The other thing, and we're going to show you the next slide, and one of the things we've learned, and they've done some great work at the University of North Carolina where they put these sensors in helmets, and they actually have the whole team actually wired up, and so when kids get hit and they can measure the data, is there is no single threshold in which you can say a concussion will happen over this level. At this point, it's not like when they measure the force, it's not like they can say, well, look, that kid, he took a hit, it was over 100, he's got a concussion. Now, are you a little more likely to get a concussion the greater the force? Sure. Absolutely, but it's not one of those things that's a direct correlation. This is, again, a little bit of a confusing slide, but so these are 19 kids actually from the University of North Carolina that had concussions. And they're actually sort of ranked in order. So case 1, and if you go over 2 lines, it said a linear magnitude of 60 all the way to case 19 where the linear magnitude was 173. So if we look, the forces, these are sort of the linear forces, these are the rotational forces. But what's interesting is you have concussions all the way from 60 up to 173, and there's no correlation between symptoms in terms of how severe somebody's symptoms were versus the force that they got hit with. So just getting hit harder doesn't mean that you're going to have a concussion or that you're going to have more severe symptoms from a concussion. There's a great video. I tried to actually get Kevin Gutzkowitz to send it to me of, he's got this player on North Carolina that just absolutely gets creamed and has no evidence of a concussion. And he's got another lineman who's just coming off the line that just kind of takes a little glancing blow, who's got a concussion and was out for a month. I mean, you look at those videos and you say, well, that absolutely has to flip-flop. The kid who got creamed absolutely has to have a concussion, and this kid had nothing. So it just goes to show you how complex this sort of diagnosis can be. And when we'll talk a little bit about diagnosis and grading, it comes into play. So how do we diagnose a concussion? Well, there's no one way to diagnose a concussion. It's mostly based on history, you know, sort of talking to the athlete, what symptoms does the athlete have, and somewhat on exam. But 99% of the time, when I see a kid on the sideline with a concussion, their exam is normal. I mean, they almost never have an abnormal exam. The really easy ones to diagnose are the ones that got knocked out, the ones that can't remember anything, or the ones that are acting totally confused. Okay, well, those are the easy ones, but that's not by far the majority of them. The majority of them often come over, and it's not even until 3 or 4 plays later, and they just say, you know, I got hit a few plays ago, I just don't feel right, I got a little headache, I got a little, and other than them telling me what symptoms that they have, there's nothing I can find on examination that's abnormal. There's nothing else, their exam's completely normal. So it really can be really subtle. Really, really subtle. And I've even had kids where they had other things going on. I had a kid 2 years ago who got hit really hard, was really, really dizzy, but wasn't having any other symptoms. And it turned out he kind of knocked loose something in his inner ear. It had nothing to do with a concussion. He was just really dizzy from the fact that he kind of messed up the inner ear on the hit. So there's all different things that can kind of happen and make this confusing. So we talk about signs and symptoms, what we might see, you know, particularly in younger athletes, sort of that teenage to collegiate, but so it would be similar in adults. So we can see often difficulty concentrating. They can be emotional. They can have a really glazed look, be sleepy, confused. Sometimes they're having memory problems. But in reality, I've never met a teenager that didn't have most of that stuff to begin with. And I say that jokingly, but it's true. How many kids in high school, if you run around and ask them if they had those symptoms or didn't have those symptoms, would have positive responses? Well, it makes it really, really hard to sometimes know what's significant and what isn't significant. Sometimes if I'm with a team and I know the kids well, I know that a kid who's normally really quiet, if he's being really gregarious and kind of bouncing around, well, that makes me wonder a little bit, and vice versa. But if you don't know the kids, which oftentimes in a lot of these games I don't know the kids on that kind of a level, it can be really hard because you know kids are kids. They're kind of weird. So again, we talk about common symptoms. Headache is definitely the most common. You know, vomiting, amnesia, dizziness, all that sort of stuff. One of the things we might do with someone who has a headache, if we're not really sure, most often headache with concussion is going to get worse with exercise. So if they do some balance testing, if we do a little running, that headaches, they're not going to feel very good. So sometimes we can do little things to try to bring things out. There's some sideline questions you can ask kids, and one of the common one, can you remember 3 things? You know, and repeat it in 5 minutes and all this sort of stuff. Well, I will tell you, I've independently done that on kids that aren't even playing in the game, and they can't remember. And so it's hard. I mean, again, they're not, because some of it is focus. I mean, am I focused on the game, or am I focused on what the doc asked me to remember 5 minutes ago? You know, so it's kind of one of those things where those tests that we use, particularly on the sideline, in terms of trying to figure out whether someone had a concussion or not, are really only useful when the concussion's in question. I mean, if I know a kid had a concussion, I don't bother asking him if he can remember 3 things. Doesn't tell me anything. I already know he has a concussion. So it's the subtle cases where you might be able to sort of bring out some of that information. So again, sideline testing, and this kind of goes to your question. Anytime, obviously, we think that someone might have, had a concussion, we certainly want to get them out of the game. We want to watch them. The hard part is in football because, in the collision sports, because there's a lot of hard hits. And like I told you, sometimes the hard hits don't really translate. But if we're concerned at all, at least what we tend to do is just, we really keep an eye on the kid. We check them after they come out of the next series and just make sure they're okay. You just kind of keep an eye on them, and if they start to develop anything else, we make sure we get them out of there. But it's really not, unfortunately, as straightforward as we'd like it to be. I talked briefly about imaging before. Again, there's very limited role for imaging in concussions. We know that if their exam is normal, that the likelihood of finding something significant on an MRI or CAT scan is almost 0. Most of the time what we do see on an MRI or CAT scan, in those cases, if they happen to get one, we can't explain. And then you run into more problems because now you don't know what to do with this piece of information that you have. Now, it doesn't mean that we shouldn't get imaging when we think we need it. So, I think probably twice a year, I'll send a kid for a CAT scan or for an MRI. We tend to use CAT scan more acutely because it's easier access. MRI tends to be more, particularly kids that have chronic symptoms, MRI seems to be a little bit better. We know CAT scans have lots of radiation, and we know that exposure to radiation as a child may increase your risk of cancer as an adult. Now, that does not mean that you shouldn't get a CAT scan when you need one. But what it means is we don't do CAT scans just because. Because 2 things, and I tell this to people all the time. Number one is, the medical literature is filled with late bleeds. So you get a CAT scan that was normal, and a day later, or 2 days later, or 3 days later, somebody starts having a bleed. So having a normal CAT scan doesn't change anything that we sort of discuss in terms of what's important to follow up with somebody. And then the second reason is, again, we know if you don't have anything abnormal on your exam when we see you, the likelihood of you having something, and the likelihood of us finding something that's going to change our management is really low. So concussion grading. I want to talk about this a little bit because this is one of the sort of the confusing things, and they still confuse it quite a bit. And I read an article today on, I forget which team it was from Sunday, and they said, well, they're not really sure how severe his concussion is yet. They haven't told us if it was, what grade it was. Well, we don't actually do that anymore, and we'll explain why. Well, basically, so the oldest thing that we used to use, basically, we would grade concussions as mild, moderate to severe. And this is sort of the 3 grading scales that were most popular. Bob Cantu is a neurosurgeon at Boston University. Really great guy. He's done a lot of good research. The Colorado Medical Society and the American Academy of Neurology. All these are three sort of guidelines. You can see, essentially, to some degree, depending on whether you lost consciousness or didn't lose consciousness, they would place you in different categories. And how long you were out would depend on where you fell. And if you had a mild one that resolved, you could go back right away. And if you had a severe one, you had to be out at least 2 weeks. Well, the problem with that really becomes that the symptoms that you have at the time of the concussion are not predictive of all at how severe the head injury is. Matter of fact, there were some studies that showed if you got knocked out, you actually recovered faster than if you didn't get knocked out. So we automatically went, well, wait a minute, we were calling the knocked out guy severe, and we were calling the guy who just got his bell rung not severe, but the knocked out guy got better way faster than the guy who just got his bell rung. The intermediate step between sort of the grade 1, 2, and 3 and the not grading, which is what we do now, is we tried to, in 2004, go to this simple and complex based on how long symptoms lasted. So if your symptoms lasted less than 7 to 10 days, we'd say it was simple. If they lasted longer. In 2008, the big group that sort of has met for 3 times now on sports concussion sat down and said, you know what, this is ridiculous. Grading a concussion doesn't help at all. Doesn't do anything. If you tell someone they have a mild concussion, it just tends to sort of tell them not to worry about it. If you tell someone they have severe concussions, they tend to worry about it too much. None of the symptoms that we see at the time of the concussion are predictive at all of how long it's going to take you to recover. Nor does it change the plan in terms of how we manage the athlete. So now, you either have a concussion or you don't have a concussion, which again isn't always easy to tell. But and when somebody asks me, well, is it mild, moderate, severe? I might say, well, look, it's a concussion, but they have mild symptoms right now, or they have moderate symptoms right now, with a caveat that, but that doesn't tell us. What we care about is how long do the symptoms last, and we'll talk about this in return to play. But what matters most is resting until the symptoms go away. So regardless of how severe your symptoms are to begin with, it's all a matter of how long it takes. Like I said, 2 of my concussions, I don't remember 24-hour periods, completely gone. I mean, I have no recollection to this day. But the next morning, I felt completely normal, even though my memory was completely, I had no problems whatsoever. Versus someone who, again, just, and I see this all the time, kids who just kind of got their bell rung and it's 2 weeks later and they're still just not feeling great. The other reason we stopped grading again was that, again, you know, too many of this sort of, yeah, it's only a mild concussion, don't worry about it. And it really becomes a problem when people say, you know, like, and Dr. Robertello can attest, I just had a mild heart attack. You know, just a mild one, nothing to be worried about. Well, so again, how do we recognize concussions? Not really easy. We talk to the coaches all the time about, you know, again, the athlete who's just not seen to be acting themselves. Just because an athlete's not acting themselves doesn't mean that he has a concussion. Maybe his girlfriend broke up with him. Maybe he didn't get any sleep last night. Maybe, you know, he's got all these other things going on. But it just may raise your radar to say, hey, we ought to keep an eye. We ought to keep an eye on this guy. So treatment. Pretty much common sense now, but any athlete suspected of a concussion comes out of the game. If we're sure that they have a concussion, they're done for that day. Now, this is very true at the middle school level, very true at the high school level, for the most part true at the collegiate level now, and somewhat true at the NFL level, or the, you know, professional sports level. There are several reasons for that, going from financial to sort of brain development. So we know young kids take longer to recover than someone who's in the NFL. So there are circumstances under which, you know, we will still return an athlete to play the same day, but it's much, much, much less common than it was even 5 years ago. But we know, particularly for the kids that we deal with here, the Castleton kids, the high school kids, even the U.S. ski team kids and snowboard kids, they're done for the day. The most important thing that you can do when you have a concussion is rest. And we'll talk about it a little more. You know, the brain has been injured. The brain, oftentimes kids are sleepy, they don't feel well, they just need the rest. The more rest they get, the faster they're going to recover. It's generally important, and we always talk to parents and coaches and things about observing kids after they have a concussion. The 3 to 4 hour window seems to be the most practical one. There's some data that suggests if you're going to deteriorate, you will tend to deteriorate, you know, prior to that time. Meaning if you're going to go downhill, you'll sort of go downhill before that time frame. The old sort of, the reason I bring that up is we've really gone away from wake somebody up every hour, every 2 hours, or every 3 hours. And there's multiple reasons for that. But again, number one is you don't not wake up if you have a more severe head injury. You'll wake up feeling lousy if things are getting worse, but you won't not wake up. You also, what's the right time frame to wake somebody up? Is it every hour? Is it every 2 hours? Is it every 3 hours? I mean, when am I supposed to wake them up? All it did was cause athletes to get less sleep, parents to get less sleep, probably prolonged recovery in terms of they just weren't getting a good sleep that night. We'll often tell parents, look, you don't have to wake them through the night. If you want to wake them up one time before you go to bed, just rouse them a little bit so you feel better. Well, then by all means, all means do that so you sleep better. But you don't have to do that. What's important is that somebody's around. I've been here 5 years now. I actually admitted one concussion from the whole time I've been here in a collegiate athlete only because we just couldn't find anybody to keep an eye on her. She lived by herself. We couldn't get a hold of any of her friends. We just couldn't get a hold of anybody. So we put her in here overnight just because so there would be somebody around, just in case. It wasn't because we were really worried about her. But in reality, as long as somebody's around, and for the most part, from a sporting standpoint, most of these kids are getting concussions, afternoon, evening. So by the time it really is bedtime, they've already been up for a while, or they've traveled back on the bus, or there've been a period where they've been sort of up and moved about. It's okay for kids to eat. It's okay for kids to take Tylenol or ibuprofen if they had a headache. You're not going to mask anything. Matter of fact, it's a common occurrence up at the Killington Medical Clinic to have somebody with a broken bone and a concussion, and we still give them pain medication. You know, you're just not, you know, do you have conversations about it? Of course. The pain medication is for your broken bone. It's not for your headache. So if the headache's getting worse, you don't take the pain medication, you go see somebody. But, you know, it's okay to do those things. We're sort of those myths of we're going to make something worse really don't exist. It's just not, you know, bad head injury shows itself right away. And I have never seen a bad head injury develop, you know, 6 hours later, 12 hours later. Does it happen occasionally? Of course. You know, we all the Natasha Richardson story from a few years ago, which I'm sure you're familiar with. The caveat to her story, and if you're not familiar, she's the actress who was in Canada and fell and hit her head. But basically, she actually had some abnormal findings to begin with, but refused treatment. So again, we talk about rest. Physical rest, but even more importantly, particularly for a lot of our high school and college kids, it's mental rest. Okay, and mental rest doesn't mean they just get to miss class. Mental rest means no video games, they shouldn't be texting, they shouldn't watch a lot of TV, they shouldn't be, you know, in loud rooms with a lot going on. Are those sort of things going to cause brain damage? No. But what they're going to do is cause the symptoms to last longer than they need to. So they're going to prolong their recovery by not getting adequate rest, by not doing that stuff. You know, what we do with kids, sometimes we have to pull kids out of school. What we usually tell kids is, you know, certainly if they're having trouble, they make sure they let us know. Sometimes it's going half days. Or our college kids, it's they go, you know, in college is a little, they can kind of get up and leave if they need to. But one of the things that we're really trying to emphasize now, because I think it's been the missing link, is the kid has concussion on Monday and he goes to school on Tuesday and he has a test or he's just not acting that well in class. And, you know, somebody in the school needs to be aware of the fact that that kid had a concussion. And we really want to do a better job, and I'm trying to with our office and certainly our athletic trainers to kind of get that information so that the schools have that information. Because, you know, you don't want to penalize a kid just because he particularly had a head injury. When I had when I got knocked out in college, you know, I walked in my English class the next morning, and of course I was the first one the professor called on. So I had to sit there and tell him, you know, sorry, I got knocked out last night, I don't remember anything. Which sounds like a pretty lame excuse, but he seemed to buy it. But so again, we talk about, the post-concussive sort of period. Post-concussive symptoms or post-concussive syndrome is really that constellation of symptoms that you have in the hours and days to weeks after you have a concussion. Where do we consider that sort of acute concussion symptom versus a post-concussive? Nobody really knows for sure. I generally consider it the next day because most of the time, if your symptoms are going to go away, they're going to go away after you slept. So you sort of sleep through the night, you wake up the next morning. If you have symptoms the next morning, we tend to call it post-concussive syndrome. The symptoms can be very similar to what you had acutely, a headache, feeling dizzy, nauseous, trouble concentrating. It will generally get worse the longer I'm awake, the more stimulation I'm getting. It's really, really important. We stress to kids that if they're up and moving around and they're feeling worse, they need to go rest for a period of time. Doesn't mean they have to be bedridden, but they just have to be very respectful of the symptoms. Why? Well, because it seems to help extinguish them the fastest. The brain seems to recover faster. Now, there's one caveat to that, and I'll go into it with return to play a little bit, is we for a long time have felt it's really, really important to have what we call a symptom-free waiting period, meaning that your symptoms are gone on day 5, but you shouldn't play till day 9 because you need 4 or 5 days where your symptoms aren't clear. Well, there's been some new data to show that probably doesn't matter, meaning the amount of time that you have from when your symptoms clear to when you play matters less than the amount of time since your head injury. Meaning the 7 days seems to sort of be the magic number. It's different for everybody. But in a sense, what I'm saying is that if at day 7 I have no symptoms, it seems to make no difference if I go back on day 7 versus waiting till day 8 or 9, as long as it's been 7 days since I hit my head. Versus the old sort of, well, your symptoms cleared on day 2, we let you go back on day 5, you're actually more likely to have a problem in that scenario than you are. And so there's just been this kind of flip-flop, and it continues to flip-flop. And everything I talk about now, we could talk about it in next year or 2 years, and some of it may change. A lot of it may change. So just we have to remember that that's kind of one of those things that, well, we think it's important to rest even after the symptoms resolve, but we don't know for sure. Again, we talk about this with kids, and parents love it when we sit around and tell them that the kid can't play video games and the kid can't text, and they think it's the greatest thing ever, and the kids moan and groan. But in reality, we're not doing it to punish them. We don't have a huge trouble usually with athletes in schoolwork because most of them they know if they're not going to class, we're not going to let them play. So it's not that sort of like, well, they're trying to milk it just to get out of schoolwork. Occasionally I have the non-athlete with a concussion where that's an issue where we're trying to sort of sort out, do they just not want to do their homework, or are they really still having problems? The symptoms can last many, many months. Unfortunately, the biggest risk factor for persistent symptoms is persistent activity in the post-concussive period. So pushing hard in that post-concussive period almost always tends to make the symptoms magnify and last longer. And I saw a kid yesterday, sort of an elite level skier who was in New Zealand, fell and hit his head, kept skiing, and he was 3 weeks out, and he was getting worse and worse and worse and worse and worse. He rested for 3 days, and miraculously he started feeling better and better. And so had he rested for 3 days in the front end, he probably would have felt better easily on day 5 or 6. And so it's one of the ways that we talk to kids about the importance of sort of resting early on, is that, we get you back, you're able to feel better and get back faster. So how do we return kids to play? Well, what's interesting, you can go back as far as 1905 and even 1937, they were talking about not sending athletes back to play after they had a concussion at that same day or in that same game. All the way back then, somewhere between 1937 and probably the 80s, we sort of lost our way a little bit. And in the 40s and 50s and 60s, it was very commonplace to play through that. And even into the 70s and 80s, and it's really, even in the NFL level, it's just really been the last probably 5 or 6 years that they've really put an emphasis on not going back. So we lost our way for a little bit in time. But really, we know that athletes obviously want to play most of the time. We know that they'll deny symptoms sometimes to go back to play. So how do we fight that? Well, it's really through education. I mean, you got to just educate the kids. We do a lot with the high schools and the college before the kids have a concussion, telling them what goes on, what it means, so that we're not trying to fight it with them after. I have kids every year and parents every year that push too hard to get back? Absolutely. We still fight it. But I stress to coaches, I stress to athletic trainers and to parents, everybody's got to be on the same board. When everybody's on board together, it makes it a lot easier to deal with sort of an athlete who's somewhat resistant. Let's talk briefly about second impact syndrome, because this goes into return to play. Second impact syndrome is a proposed, and I say proposed, condition in which sort of the brain is not fully recovered from a head injury. I sustain a blow, which is often said to be a lesser blow, and I have a catastrophic sort of swelling and problem with my head. There are, number one, there are many of us who do not think that a condition exists, and I'm one of them. I don't think there's such a thing as second impact syndrome. I think there's such a thing as first impact syndrome. I mean, I think you can die from a head injury. I don't think there's any question you can die from a head injury. If second impact syndrome does exist, it is incredibly rare. Remember the numbers we talked about with concussion. So there's, over the last 40 to 50 years, there's been 35 potential cases reported of second impact syndrome. When you go through and you actually look at those cases, there's probably 4 that actually meet criteria for second impact syndrome. And those 4 actually depend on recall of people to say, well, did you hit your head? Did you have a headache? Did you have any of this stuff? Was he ever complaining? If you say, well, did your son now has a catastrophic brain injury, he's playing football, did he ever complain of a headache before this happened? Well, what are you going to say? You're going to say yes. So it's really hard to know what the entity is. And the reason I bring that up is, again, we're not trying to sort of minimize the catastrophic head injury is terrible. It's fortunately really rare. And you can see at all levels, sort of high school, collegiate, and NFL, it's about 1 death a year from head injury, from catastrophic head injury. So it's really rare. Matter of fact, they haven't had a death in the NFL from head injury in 20 years, 25 years, I think. It's been quite a long time since they've had it. Just where it's only the head only, that's the problem. They've always had neck, and the neck sort of been the biggest one. So when we talk to kids about return to play, I personally don't scare them and like, you're going to die. Some people do. I don't say that, because the truth of the matter is, it's not likely they're going to die, and kids are smart enough to know that they're not likely to die. So you have to give kids the right information, and you're still going to have some kids that are going to lie to you. It is what it is. But so I think everybody's a little different, and people will stand up, and I've stood up at conferences and you argue back and forth about second impact syndrome. In the end, catastrophic injuries are really rare. Let's give kids the right information about return to play. The right information is that if you rest early and allow us to help you, you will be back sooner and better. If you push through the symptoms, or you don't tell us about your symptoms, you're likely to feel worse longer. You're likely to sustain a second injury that's going to keep you out longer and make you feel worse. Not necessarily going to cause permanent damage, but going to make you feel worse and make you have lost time. And so that's what we really emphasize. In general, this is sort of our strategy for return to play, although I will tell you that there is no good evidence behind this. We don't have any good evidence to say that this is absolutely the way that you have to do it. But basically, we tend to do it in phases. So we say, day one is the day that you're symptom-free. I have no symptoms whatsoever. I feel totally normal. And when I get to day one, I do some light activity. And if I feel okay on day one, and I don't have any symptoms later that day, then day two I can go on to, more intense activity and then ramp myself up. So this basically is this talks about 5 days. It may be 7 days, depending on the athlete. It may be 2 or 3 days. It may be one day. I had a golfer with a concussion a few years ago. I mean, I let him play as soon as he felt fine. I mean, it's not, we weren't going to keep him out of. He slipped and fell at home. He didn't get hit on the golf course, but and so it really is relative risk. I mean, we're a cross-country runner. Well, in reality, as soon as they're sort of symptom-free, we let them start ramping up versus a football player or something where the risk is greater. Why did we do this? Well, we know from some of the neuropsychological testing, and those are those complex tests that sort of test brain function, that from the time that the brain you feel asymptomatic, there tends to be a lag of somewhere between 2 days and 7 days for the brain to catch up by the testing. So we said, well, look, that makes sense then. We should just build you up and give you those extra days to go back in. But what I was talking about earlier, which I know is a little confusing, but again, what we're learning is the number of days symptom-free, meaning how many days I'm out from sort of having no symptoms at all, is less important than the number of days out from the injury. So the days out from the injury seems to be a much more important number. So it may come a time where we go back to, look, rather than sort of day one is the day where I'm symptom-free, it's really day one is day 7. So I'm 7 days out because that seems to be the window. Then we can get you back in, assuming that you're feeling okay and you're not having symptoms. Quickly, neuropsychological testing. There are probably 3 main computer-based tests that people use now. Impact is the most common one. This is done out of the University of Pittsburgh. CogSport is another one out of Australia. I have it on my computer. It's a computer test. The kid comes in and takes it, and it gives you some idea of brain function. The problem with it is it's a great research tool, but we don't have any data to suggest that kids do better if we use it. I mean, if we use this test, is a kid going to be less likely to get a concussion? He's going to be less likely to have a problem. I see lots and lots of athletes that have a concussion. The next day they pass their test fine, but they're still symptomatic. So the test is totally normal, but they're still having symptoms. So is there a role for this testing? Well, the answer is probably. It makes sense probably even more at the NFL level, the NHL level, where your exposure has been so great over years of high school football, college football. You're in the NFL, your risk is much higher. It gives you another data point. At the high school level, the odds of this test making a difference in how the kid does long term is pretty small. I like to personally use it on kids that have had multiple concussions, kids where, I have some kids with severe ADHD that we want to know what their test, because ADHD can mimic post-concussive stuff. I can't concentrate, I have headaches, I have all this sort of stuff. And so that test sometimes gives us another piece of information to help us. Everybody's different. We do at Castleton, they use it for their football players. Everybody gets a baseline test. You'll see a lot about it and you'll hear a lot about it in the news. Understand that it's a very, very financially lucrative thing for those companies that make the test. The companies that make the test are the ones that have 95% of the positive research about the test. And so if you go actually to the studies that don't involve the company, they're 50-50. Some show a little bit, some show they don't. But the ones that the company does, well, they're all positive. and so you have to be careful in terms of how you interpret that and use of resources and things like that. And we can talk about it more. So multiple concussions, obviously everybody gets concerned. This is a hot topic. How many concussions is too many? Nobody knows. There is no set number. 3 seems to be the number where most athletes will start to have problems, meaning if I have 3, once I start to get more, they tend to take longer to recover, they tend to last a little bit longer. But again, so I had 7, some people we worry about them after 1. So there really isn't a magic number. It really boils down to, it's a very, very individual thing. When do we get concerned? We tend to be concerned when there's 3 things that happen. Number 1, it takes you longer and longer to recover each time you have a concussion. So the first one you felt better in 3 days, the next one you felt better in 7 days, the next one took me three weeks. I'm starting to it takes just less and less, and I saw this the other day. I saw an athlete who has had multiple concussions, and all she did was head the ball. And we'll talk about heading in soccer, but all she did was head the ball and felt like she had a concussion. Okay, that that raises an alarm in someone who's had 5 or 6 concussions. I'm a little concerned about what may be going on. And then obviously those behavioral and emotional changes that we see sometimes, particularly in the younger kids after they had head injuries. When those start to add up, that's when the flags start to go up. The problem is sometimes we don't send the flag up soon enough because they may have been fine after the first 2, but after the 3rd one, now they're having lots of problems. But we can't back up, unfortunately. So we have to figure out a better way to do that. This is not the best graph, but this is basically the NFL data. So this is one of the common things in the media. So am I going to get Alzheimer's if I played in the NFL? So the red one actually is the U.S. male population. The yellow one is the NFL. But you can see that at age 69, from age 69 to about 74, if you played in the NFL and you're retired, you have a higher chance of having Alzheimer's than the average male. But once you get to about 75, everybody's about the same. Okay? So what does that mean? Well, the truth is we don't know because we have really small numbers from the NFL. What it probably means and what people think it means is that if you are genetically programmed to get Alzheimer's, and Alzheimer's really is probably somewhat environmental, but it really is one of those things that you probably are genetically programmed to get. If I'm genetically programmed and I hit my head a lot, I'm going to get it sooner than I would have if I didn't hit my head a lot. But it doesn't mean that I wasn't going to get it. It just means I was going to get it. I'm just getting it sooner now. So rather than get it at 75, now I might get it at 65. Now, is that significant? Absolutely. Absolutely. But it doesn't mean you never would have got it. And so what we talk about sort of with knee injuries, meaning you injure your knee and you're going to, if I'm programmed to get arthritis at 70 and I injure my knee, well, I might get arthritis at 55. But it doesn't mean I wasn't going to get arthritis if I didn't injure my knee. It just means I'm getting it sooner. So there was a recent article that came out that talked about Lou Gehrig's disease and head injury. And they said, boy, we did these autopsies and we found this bad protein in these guys, these basically retired NFL guys that had problems, that had ALS, and 2 NFL guys and 1 boxer. So first of all, it's only three athletes. But if you actually read what the authors wrote, they said, we can't speculate on this. All we can tell you is that we found this protein. And it was the news that said, oh my goodness, this protein is linked to Lou Gehrig's, and so head injury must cause Lou Gehrig's disease. That's the kind of stuff that, those are the leaps the media take. Boston University sort of is the center for retired, is doing all this brain research on the retired NFL guys. If you actually talk to anybody there, they will tell you, we don't know. They have very few brains. The brains that they have are the NFL players that had trouble. They don't have other NFL players that didn't have trouble to actually compare to say, is there a difference between the guy who had trouble and the guy who didn't have trouble? So it's not a simple equation as if I play in the NFL, I'm going to have a problem, or if I box. As a matter of fact, if you look at the boxing data, most boxers don't end up like Muhammad Ali. He's the exception, not the rule in boxing. Versus arthritis, if you play in the NFL, there's a 99.9% chance you'll have arthritis. That we can tell you. But it's not. But it doesn't mean that you're going to have problems. So when we look at that data and we look at kids, I am not worried about 99.99% of the kids that I take care of because most of them aren't going to Division I college to play football, and most of them aren't going to the NFL. They're not. So high school is the greatest time when they sort of expose themselves to this issue. And then after high school, everything sort of drops off. So these guys in the NFL, when they say, oh, I had 10 concussions. No, they didn't. They had 30. You had so many in high school, you had so many in college, you had so many in the NFL. You can't get to the NFL with having probably less than 5 or 6 to begin with, and probably more. So when you talk about sort of cumulative numbers, it's really greater than gets reported in terms of these guys that are out there saying, oh, I had these problems from it, and there's genetics, and there's all these other things. But just understand, and part of this is, I am not trying to underplay that we don't want to protect our kids from having long-term problems. We 100% are. But I'm not worried about what the NFL data says because I don't take care of an NFL team right now. If I go back and start taking care of an NFL team again, then I'll worry about the NFL data. So don't look at the NFL data and try to translate it in any way, sense, or form to the kids, to your kid, to the kids you take care of, to the athletes that you deal with. So heading in soccer, this is always kind of one of those myths. We'll kind of go through some of this stuff quick. There's no evidence that heading causes long-term problems. Can you get a concussion by getting hit with a ball? Sure, one of my concussions was getting hit by the ball. But does heading cause long-term problems? No, it does not. Most of the concussions come actually from head-to-head stuff in soccer, not ball-to-head. So prevention. The truth of the matter is we don't know. The only way that I can sort of teach kids to not get concussions is to not play sports. I mean, it's the only way I know. I mean, we don't necessarily have the ability to say, hey, you're not, we can keep you from getting a concussion. People, tends to make people sort of jump up and down and scream sometimes, but there is no evidence that helmets prevent concussions. As a matter of fact, if you remember, we said in the beginning, force equals mass times acceleration. There is some evidence that heavy helmets, like football helmets, can increase the rates of concussion because they're mass. What are helmets good for? Well, they're awesome for skull fractures, for more severe kind of bleeding sort of stuff, for lacerations, for hematomas. They're fantastic. So this is not an anti-helmet speech at all. You should wear a helmet. But there's several factors to go in as to what the helmet can protect you from. The helmet does nothing to stop the acceleration-deceleration force. Right? And we talked about that before. It helps with the impact. So if I'm sitting here and someone comes up and I'm wearing a helmet and they hit me with a baseball bat, does it help prevent injury and potentially concussion? Sure. But that's not where we talk. That's not the most common way concussions happen. It's sort of that acceleration-deceleration. Again, they protect against impact. The newer football helmets designed and the companies push these things have not been shown to do anything to concussions. Some early data actually showed they increase rates of concussions. And then a couple studies said, well, maybe they don't do that and they may help a little bit, but nobody knows for sure. The truth of the matter is, by what we know about concussions in terms of that force, acceleration, deceleration, you probably can't make a helmet that is plastic enough, because to stop acceleration, deceleration, it has to actually give and deform. Well, that's not what a helmet's designed to do. A helmet's designed to disperse force quickly. It's not designed to sort of give and slow down at a slower pace. So I can't design a helmet that can do both very well. They can probably either do one or the other, although I don't know you could design a helmet that could be sort of plastic enough to absorb that sort of force. Padded helmets in rugby and the headbands in soccer, if you put them in a lab and you put force against them, do they decrease the force to the little dummy with the little marker? Sure. Do they decrease rates of concussion in real life? No. For the reason we talked about, right, the acceleration, deceleration, and they also actually increase rates of concussion in most studies. You know why? Because of something that's called risk compensation. Basically what it means is, if I protect somebody better, they're likely to increase their risk. So you tell me these guys would hit like this if they didn't have a helmet on. And then you put a helmet on them. So the difference between rugby, same thing in rugby. You put a helmet on a rugby guy, now he's not as worried about sort of leading with his head. If you're a skier or a snowboarder and you wouldn't go into the terrain park without a helmet, but you put on a helmet and go into the terrain park, I've essentially just canceled out some of the benefit of the helmet. Because now I'm dropping off of 40-foot cliffs, or I'm jumping over these gigantic gaps. So even though, yes, if I sort of stayed on the bunny slope with the helmet, does the helmet give me some protection? Sure, because I didn't change my behavior. But that's not what happens to people. We know, look at the X Games. Look at all these people. I mean, they just pad themselves up like crazy just so they can jump higher and jump farther. So the protection sort of balances out. And it's one of the reasons why when you pad people up, helmets don't necessarily help protect against that sort of stuff. But again, it's strictly for like we talked about. Mouth guards, this is another common one. Mouth guards, there is no evidence whatsoever that they prevent or decrease the rates of concussions. They are fantastic for protecting your teeth. Okay, and this guy obviously didn't wear one. They're fantastic. And so if you play a sport that has a high risk of dental injury, by all means you should wear mouth guards, without question. But the reason to wear a mouth guard is not because it decreases concussion rates. It came initially from some dental data that showed if they were in the lab and they put a mouthpiece in and they measured forces kind of through your jaw, it would decrease the force a little bit. But again, lab data. And there's been multiple studies actually on athletes and college athletes that have shown that they don't seem to make a difference. Okay, so again, great for dental protection, not for concussions. So again, how do we prevent somebody? Well, again, we talk about exposure. I might have been able to prevent this concussion if I could have talked this kid out of being an idiot. There are some rule changes in football in terms of spearing. We talk a lot with coaches about what's going on around, what things can I control. If you look at sort of, this guy's just, if you look at sort of, we take skiing for instance, we talk to coaches, look, if it's icy, if the conditions aren't good, why are you training under those circumstances? I had a concussion in an academy level skier 2 years ago because the coaches sent them out to go for a run in a skier in the middle of the winter on an icy road, and they slipped and fell and hit their head. That made no, why would they? You know why they were going for a run? Because the coach didn't want to deal with them. I understand. I was a coach. I coached high school and college soccer. I know sometimes you don't want to deal with the kids and you want to send them out. But the point is not so much that I think coaches, for the most part, try to do the right thing, but it's just really sort of trying to say, okay, what are the conditions of what's going on? Are there circumstances that I can sort of look at to say this might decrease the risk of, potential injury because of weather, because of what else is going on? But in honesty, other than behavior change, I don't go in the train park, I don't huck myself off of things, I don't lead with my helmet. There's probably not a whole lot that we can do to actually prevent concussions. And it's really too bad. It'd be nice if we could come up with a way, but there's probably not a way that we can do that. So neuroimaging, we're looking at MRIs, we're starting to see little changes in things that may, in the future, give us some idea of what the injury is and how to better treat it. But as of right now, all it does is confuse the picture. I mean, I talk to people all the time. They get this really subtle little finding on the MRI that nobody knows what to make of it, and can the kid go back and the kid not go back, and we don't really know. We know a lot more about neurorehabilitation now. There's actually some very, very focused things that we can do to help kids get healthier faster, or help those kids that are having prolonged symptoms. And rather than rest, it actually involves actually doing exercise. It involves things like computer games and Wii and balance testing and balance training and all this sort of stuff. And people are also looking at things that may help brain cells recover. So fish oil, omega-3 fatty acids, antioxidants, these sort of things people are looking at. Nobody should jump to sort of the reflex of, oh my God, everybody who hits their head should have more fish oil. There's actually some studies, and not concussions, but head trauma, that actually show increased mortality or increased death if we give high doses of fish oil. Why? Because most likely fish oil thins the blood, potentially bleed more. So we're not saying you should, I'm not saying you should do that. I'm just telling you people are looking at that. We're trying to figure out are there ways that we can sort of help with that sort of stuff. So in summary, again, a lot of things have changed. There's a lot of bad information out there. The most important thing I can drive home is that every single athlete with concussion should be treated individually. They all need to be treated as individuals. Not one is the same. And not one concussion in the same athlete is the same necessarily. So they all need to be treated individually. They all, again, ideally would be evaluated by someone who's familiar with concussions, because I think there's enough changing and it changes fast enough that it's hard to keep up with. Again, I also want you to take home most kids and most athletes are going to do fine. And they're not going to have problems. They're not going to have long-term problems. But the caveat to that is, and what we really need to figure out and what the research is really focusing on is, how do I keep kids from getting to that bad point? Because right now, I don't usually figure it out until they've already tipped over the edge. They're sort of already starting to have the problems. And I don't know, and we don't know at this point, how do you, because you take someone like me who's had 7, never really had an issue. And you take, it takes some kids have 2 and they're already starting to have problems. So I think all we can do is really try to raise our radar, try to make sure, again, and this is going to be making the schools, we're getting the schools involved, and our kids starting to fall. I mean, I don't see what a kid does in school. I don't know what their grades are, unless I ask specifically. So we may need to do some better tracking of these kids and have the schools help us. Are the teachers starting to notice things that, hey, little Johnny's sort of not acting like he was before. It doesn't mean it's his head stuff, but it means it may raise the radar for us. So contact resources. Anytime, there's a really, really good course for coaches that's free and for anybody to take it at the cdc.gov website. It's a heads-up concussion program. They have lots of information. But the National High School Federation for Sports put together sort of a little video. It's really well done. It's actually one of the few things sometimes the government got right. But it's free, and so you can always go there. Anybody's always welcome to call me. That's the office number there. I do have some cards with me, but I think that the best thing that we can do is get the right information out there to everybody.